Welcome to MedExcel Tuition Center. My name is Dr. Boniface Kasaway, and today I'm going to help you understand the FIGO classification of uterine fibroids. So, uterine fibroids are classified using the FIGO classification system based on their relationship to the endometrium and the myometrium. So, why is this important? So, FIGO classifies fibroids from type 0 to type 8. Helping guide symptoms management and surgical approach. So, how does FIGO classify these uterine fibroids? So we have type 0 to type 8, type 0 to type 2 being submucosal fibroids, and these commonly cause heavy menstrual bleeding and infertility. Then we have type 3 and type 4, which are intramural fibroids, and these may cause pressure symptoms like bladder symptoms or bowel symptoms. So under the bladder symptoms, you have hesitancy and frequency. Then under the bowel symptoms, you can have constipation. So these are just pressure symptoms on organs surrounding the uterus in the pelvic region. Then also you can have abnormal bleeding in these types of fibroids. Then you have the subserosal fibroids, which comprise of type 5, type 6, and type 7. These give more pressure symptoms because they are more towards the outer part of the uterus. Then you have type 8, which are just fibroids in unusual locations. You can have a parasitic fibroid, a cervical fibroid, which can impinge and give problems during labor. So what is the clinical importance of this FIGO classification? So this classification helps determine symptoms, the impact on fertility, and the surgical planning, especially for hysteroscopy and myomectomy. So how do I remember this classification? So let me help you understand using the aid of a simple diagram. This is just for illustration purposes. So imagine this is the uterus, the cervical part, so according to the FIGO classification, we have from type 0 to type 8. Type 1 being pedunculated submucosal. What do they mean? So these fibroids will have a peduncle, which is just more like a stalk, and they will be inside the endometrium. So this is type 0. Then you have type 1, which is less than 50% intramural. So this fibroid is just slightly inside the myometrium, but most of it is in the endometrium. So this is just slightly in the endometrium, in the intramural part, sorry. Then most of it is in the endometrium. This is type 1. Then you have type 2, which is now more in the intramural part as compared to the endometrial part. So you're going to have more of this fibroid inside as compared to outside. Outside being the endometrial side. Then you have type 3. So type 3 is just close to the endometrium, but 100% of it is intramural. So it's just close, attaching to the endometrium, but most of it is inside the muscle. Then type 4 is completely intramural, and it's just inside, without touching any of the sides, but it's just in the muscle. So this is type 4, completely intramural. Then you have type 5, which is less than 50% subserosal, so meaning just part of it is outside the uterus, but most of it is inside. So most of it is inside, but just a bit of it is outside, but most of it is inside the muscle. Then type 6, which is being 50% is outside the uterus, so meaning you have 50% of it outside and just slide of it, a bit of it into the muscle. Then you have type 7, which is now a pedunculated subserous, so it's having a peduncle but it's outside, and this one is more prone to torsion. It can twist and cause pain, even the one that is inside the endometrium. Then you have type 8, which can be either a cervical fibroid, a wandering fibroid, or a parasitic fibroid. So this portion here going down is the cervical part. So if you have any fibroids in this area, we are calling that a cervical fibroid, and this is classified as type 8 under the FIGO classification. Or you can have the fallopian tube there, and you can have the broad ligament. So any fibroid that is in this area can also be a wandering or parasitic fibroid, or just any fibroid elsewhere that is wandering. Maybe it was a subserous, so then it got off and was just wandering. That becomes a wandering, and it is classified under type 8. So that's about the FIGO classification. This is the simplest way of remembering it. Just make a simple diagram and make sure that it's just moving from inside going outside. And this is how FIGO came up with this classification. So remember, FIGO classification is equal to location plus depth. Master it and fibroids become easy. Thank you very much.